Hello there, Brian Nolan here, and welcome to video 4 of our series of caring for carers who care for people during this COVID-19. Today I'd like to look at that whole area of difficult questions. We're talking about communication and talking with patients. The most difficult question I think at a time like this that a patient might ask is, am I dying? Now, that's often met with, no you're not, pet. So we're all dying, pet. I'll be dead before you. Nobody ever means any harm by saying this. What we're trying to do is keep the person upbeat and keep them positive. But actually what we do by saying something like that is we close down the conversation and we close down the patient and lose an opportunity that we might have to allay fears and answer concerns. A more compassionate approach might be to say to the person, if they say to you, am I dying? Might be, are you feeling that bad today? What's wrong? Tell me. I'm here. And as you let the person talk and tell you what's wrong, listen. Don't be jumping ahead in your head trying to think of an answer. When we do that and try and fix or come up with solutions, we've actually stopped listening to the person and really might miss the kernel of what the person is trying to say. Caution here. Not every person who asks that question wants a direct answer. They actually might just be looking for your attention to address some other concern. It's really important that we check it out first. You could, as you're listening to the person again, notice their mood. Are they sad, frightened, worried? Address that again, like we said in video 3. Are you sad? What are you sad about? Are you sad about anything in particular? You could also say, if you thought you were dying, would that frighten you? If you thought you were dying, is there anything that you'd like to do? If you thought you were dying, are there people that you'd need to see or speak with? Is there anything there that I could help you with? Now you might feel that this is beyond your role to deal with this, but think please, you may be the only person that the patient has asked that question of, so you need to honour it. If you feel it's beyond your role, do say to the patient that you will bring their concern with their permission to somebody who maybe can answer their questions. It's so important that we engage with this, and please remember, you may be the only one that this person expresses that fear to. It's always very difficult when somebody asks you, am I dying? It's like a thump in the chest sometimes, and we're never quite ready for it. But we should sort of think about these questions as not if that question would be asked of me, but rather when that question is asked of me, how would I like to address it? It takes a bit of courage, but please take the courage, because sitting with somebody who actually trusts you enough to ask that question is a real privilege, and again will make an incredible difference to the person you're caring for.